Today's video of medical education series is about curriculum development with an example. Now first once again, what is curriculum? Curriculum includes all the education related activities and how to achieve that goal in a medical school, or in short, everything that is done in a medical school. It comes under the definition of curriculum. So there are 6 steps of KERN: problem identification and journal needs assessment, targeted needs assessment, goals and objectives, educational strategies, implementation, evaluation and feedback. So we will discuss one by one. So first you have to identify the problem. That what is the problem? Identify the health related problem. That develop a curriculum to teach residents in ophthalmology a proper rotational program so that all the subspecialty areas should be touched at least 6 months in each subspecialty of cornea, glaucoma, oculoplastics. Now why it is a problem? Because the existing training curriculum has got limitations, as it is apprenticeship based, depends upon your supervisor's skill. If he is a glaucoma specialist, you will learn about glaucoma a lot more than the desired all 4 years, and other important subspecialties will be deficient, like cornea, retina, cataract, pediatric ophthalmology, oculoplastics. So though you are in a 4-year residency program of a general ophthalmology and not in glaucoma super specialty, but you will become glaucoma expert, and in exit exams you will be asked in all subspecialties equally, so it will be difficult to clear the exams. And even when you clear the exit exams, you will not be able to serve the patients, the society as efficient as the one who is gone through all fields equally. So there will be deficiency, a problem. The problem we have identified, and whom does it affect? It affects patients, healthcare professionals, society. And what does it affect? Well, it affects the clinical outcomes, the quality of life of a patient, the use of healthcare resources, medical and non-medical cost, patient and doctor satisfaction, work and productivity, and a doctor is also not very confident. So now journal needs assessment. We have identified problem and discussed in detail. Now journal needs assessment, that what is currently being done by following patients, healthcare professionals, supervisors, medical educators, society. Currently we have discussed that you have one supervisor and one ward, and whatever is done in that premises you learn. So what personal and environmental factors impact upon problem predisposing, enabling and reinforcing? What ideally should be done by patients, doctors, society? Should include a rotation policy, 6-month rotation in each and every department, subspecialty department. So and the more he should learn the most common diseases of that specialty, which is required in his annual exams, and when he goes out in the community he should serve with confidence, and he should be because he should be dealing the general problems of all subspecialty. Now, what are the key differences between current and ideal approaches? So, general needs assessment is a process of identifying what already exists and what is missing in the program, gaps in services. So, now we have identified the gaps, that what is the gap in this training program, and what is already implemented, and now we will try to solve this problem. Current training program, the major concern of the product which is coming out into the market. Patients want quick and permanent relief, and they want their doctor to know basics of all subspecialty fields so that they can benefit the most. So, training in these disciplines, rotations in these disciplines can increase confidence and decrease referrals to the subspecialists. Preferred training is in the clinical practice with trained preceptors of all those specialties. Now, that is the step 1. Let's come to the second step, which is the targeted needs assessment. Now, assess the differences between your specific learner deficiencies and general audience. Assess environment to help tailor intervention, to help tailor make the program. Identify stakeholders and build a relationship with stakeholders. Now, here the stakeholders are patients, learners, teachers, administration. Now, methods for collecting info. Review the existing training program, the senior resident exit survey, survey of current residents, focus group of residents. You can ask that how they feel they are satisfied with their training, whether they are satisfied with their surgical skills, their clinical skills. Then findings: strong desire for training, low levels of training and clinical experience, and self-related proficiency. Preferred direct supervision of patient care by practitioner with expertise in rotation fields. So, now these are the targeted needs assessments, and now we will move to the step 3, goals and objectives. Now, goal is a broad educational goal to improve the standard of general ophthalmology residency with rotations in subfield. And objectives should be SMART: specific, measurable, achievable or attainable, relevant and time bound. Helps prioritize, achieve target. The objectives: direct content, identify learning methods, enable and direct, evaluate, provides clear communication to the learner, faculty and the stakeholders. Types of objectives. The training objectives are its cognitive, psychomotor and affective skills. The process objectives are curriculum implementation measures, and patient objectives are patient satisfaction. Now, healthcare system outcome is a board pass rate, that as we have improved that whether we have improved the standard of training and the pass rate and competency level is increased or not. Then the writing objectives, these are the 5, that who will do how much of what and by when. Who, the first objective, that who will do the second objective, how much, third, of what, fourth, and when. So it means that making an environment that first rotation will be done in this time frame, and who will teach, and who will be the trainee, and how the timetable will be set, how much time he will spend in each specialty, what things he will learn, and when he will learn what things. So then comes the fourth step of curriculum development: educational strategies. It maintains congruence between objectives and methods, use multiple education methods, choose feasible methods. I have shared this timetable with an extensive framework of educational methods and type of objectives. So go through it in detail. And educational strategy example is the development of workshops, seminars, and syllabus material on common ophthalmic disorders of all major subspecialty subjects, including the major and common surgical procedures which they should learn within the specified training time. Institution of separate blocks of subspecialty within the eye department, and organization of rotational policy for residents through all. It also involves all the feasible educational methods to achieve these objectives. So now comes to the next, implementation. Identify resources, that whether you have got the resources or not. Resources of personnel, the teachers that are available in each subspecialty, time allocated, facilities, whether every subspecialty block have got outdoor facilities, they have got wards, they have got separate OTs, and if not, do you have got the funds to arrange those subspecialty rotations, internal and external support. You have got budget, whether you can get budget from somewhere else, anticipation and address barriers, shortage of resources, trained staff, do you have got a trained staff or not, equipments, do you have got equipments, some equipments in some subspecialties are very costly, attitudes, whether the supervisor they are willing to teach according to the level of the trainees, and attitudes of the learners and the staff. Develop a plan for introducing curriculum. So pilot, then phase in, and then full implementation. So example of implementation is 6-month mandatory rotation policy can be implemented. Financial analysis, feasibility had to be done, administrative support was obtained, and plan discussed with all stakeholders, and they agreed upon the plan. Now comes the last step of Khan's curriculum development cycle, the evaluation and feedback. Now you have implemented, and now you need to determine if goal and objectives are achieved or not, whether the learners learning is improved with this structured training or not, how much improvement in the final product has achieved. It also provides information for further improvements, because it is not the end point, it is a cycle, and after implementing you will also get the loopholes that still there is room for improvement, and then again you can continue through the cycle. Evaluation questions address the learner objectives and evaluation design, consider internal and external validity, post-test, pre-test, post-test, and control group. So These are the steps of curriculum development. Curriculum development can be applied for any activity, and also here a model for curriculum blueprint is shown. Now blueprint is necessary to achieve your objectives. It contains learning outcomes of knowledge, skills and behaviors, the domains, the time hours, that in how much time you will achieve your objectives, and assessment method as well. So and again the 6 steps of curriculum development, and I hope after watching this video you will be able to understand how curriculum is developed. Thank you very much.